Let us discuss two questions related to ventricular septal defect. So the first case discussion, a 40-year-old female, a known case of ventricular septal defect since 7 years, has come with the complaints of hemoptysis since 20 years worsen now. On examination, clubbing and cyanosis was present. Chest X-ray and ECG showed right ventricular hypertrophy and enlargement of pulmonary artery. What is the pathophysiology behind the symptoms and how do you manage the patient? So first of all, when you talk about these patients, yes, she is a known case of ventricular septal defect. So this you know. Now she has complaints of hemoptysis. So whenever we talk about hemoptysis in a person with congenital cardiac anomaly, there is always something to do with your pulmonary artery hypertension. So it indirectly denotes that your pulmonary arterial pressure is going to be more. So now they have also given that in findings clubbing and cyanosis are present. So I have described in the session on ventricular septal defect that whenever there is going to be right to left shunt, which is called as Eisenmenger syndrome, there can be the deoxygenated blood which is present more, so which causes hypoxia, so because of which you can have cyanosis, clubbing and all that. So therefore here the person has developed Eisenmenger syndrome, that is reversal of shunt, because of the increased in the right ventricular pressure, so which is also suggestive from right ventricular hypertrophy, enlargement of pulmonary artery tells that the person has got pulmonary artery hypertension. So now with all this together, we can very surely say that the person has developed Eisenmenger syndrome now. So therefore this woman is having Eisenmenger syndrome. So she was a primary case of a ventricular septal defect who has developed reversal of shunt now. So for these patients, you manage mainly with heart-lung transplantation. So when a person has developed the Eisenmenger syndrome, reversal of shunt, the main mode of treatment is heart-lung transplantation. So the better way to treat this person will be with heart-lung transplantation. So the next MCQ, a 32-year-old woman is seen by her primary care physician in the clinic for routine follow-up of her hypothyroidism. She also has a history of complex congenital heart disease with a partially corrected ventricular septal defect with predominantly right to left shunt across her patch. She denies any heart failure or neurological symptoms. A routine CBC is drawn and shows a hematocrit of 65%. Which of the following is the most appropriate management of her elevated hematocrit? So coming on to your options, you know whenever a person has got right to left shunt, where we have discussed that it is Eisenmenger syndrome. You know in Eisenmenger syndrome, because of hypoxia, your erythropoietin increases and your RBC is going to increase. So therefore there can be polycythemia. So therefore in these patients, obviously because of hypoxia, your erythropoietin level is going to increase. So this you know, even without checking quintal, erythropoietin level is going to be high. Now coming on to phlebotomy, so whether you do phlebotomy for these patients, say phlebotomy you do only when the person develops any neurological symptoms because of polycythemia. But this person has not developed any neurological symptoms, so there is no use of doing phlebotomy in this person. So what do you actually have to do? So better is to have waiting, so wait and watch. So in this person, the better thing to do would be expectant waiting. So you have to wait and watch for if there is going to be worsening of symptoms. So that completes a discussion on ventricular septal defect.